Good morning. For those who I haven't had the pleasure of meeting, my name is Matthew Melchior. I welcome you on behalf of Primacare Living Solutions to the groundbreaking ceremony for Henley Place, London. Acknowledging the start of a facility is a really special time. For the community, the Southwest Lynn will have another important and proud member joining what is exemplary organizations in a care delivery chain. For Primacare Living Solutions, we, as a family, see this celebration as the birth of a sister facility to our other two facilities in St. Catharines, which is Henley House, and Burton Manor in Brampton, Ontario. Two teams have come passionately together to create this facility. We say passionately, and I mean passionately, because we are a resident-driven organization, and our residents are the raison d'etre. So today really, truly is a joyous, joyous occasion, and we are really so happy and proud that you've come to celebrate with us. In order to initiate a project of this scope, there is the work of many, many, many people. We need to procure land, so we go see our friend Steve Stapleton. We have to work hard on architectural design, so we see Seppo Canerva, whose mastery of architectural design is par excellence. We, again, remember this is home for residents, so we see Lucinda Harp, who's here, who helped us make a home-like environment for our residents. We have to remember that when we're conceptualizing a building design, we have to make sure it complies with municipal codes. So we worked very hard with Mayor Fontana's team at the city. We worked diligently with Kevin Grossi and the team at the Ministry of Health and Long-Term Care to ensure that this project meets and exceeds the design requirements as put out by the Long-Term Care Ministry. We also have to recognize that we have to finance a facility. And we go and visit our friends at Stonebridge, Bob Culliver and Louis Belanger, along with our friends at Canada Life, and we appreciated their assistance. We needed banking for day-to-day banking today and tomorrow. So we went to go see our friend Bill Clementi at the Royal Bank of Canada. We needed to initiate construction. Bob Svievich from the team at Quorum Construction Group, along with my nephew, third generation in the construction business, Albert Melchior Jr., working along as project manager for the project, working along with Megan, working along with Eric, working along with Keith on the site, engaging carpenters, engaging plumbers, engaging contractors. To get to this point, we have put in a lot of work and have a lot more, and we're very thankful to be able to do that. And we know that when December rolls around next year, we will have a first-class facility. But wait, before you can open that first-class facility, it just doesn't work so easy. You have to make sure you do a lot of pre-opening work. So the team at Henley, the team at Burton, the team at Primacare head office will be working diligently, months in advance, to ensure that the systems, the procedures, most importantly, the people are in place to welcome our residents, because again, it's about the resident. So I believe that when you celebrate a groundbreaking like this, you really have to celebrate the hard work of a lot of people. And really, this is a celebration of their work. To me, it's a manifestation of when people come together, these are the great things that can happen. And we're really excited about that. And we, the Melchior family, thank each individual person for their contribution and what otherwise is a Herculean task that could not be done alone. It's great to see teamwork produce such a wonderful event. Minister Matthews, we thank you for the confidence put forward in our organization. We know this facility has been a long time coming. We wish we could have avoided the financial storm of world markets, but the good news is we're here, and most importantly, we're dedicated and excited. Mayor Fontana, again, thank you very much for all the guidance, and Peter White, I saw here from the Economic Development Office, thank you so much for your assistance to get us to where we could start this facility. Excuse me, I got a little bit of a cold. We also look forward to working with the Southwest Lynn. Had the opportunity to speak for a couple minutes with Board Chair Lowe and President Michael Barrett, and we're excited about looking at innovative strategies directed at serving the community, directed at enhancing the resident experience within the facility. Private Care is a relatively new company. We've been in long-term care for north of 10 years, and we have a dedicated staff of individuals on our team that have a depth of experience and knowledge. And that experience and knowledge will allow us to translate into first-class care for our residents. We recognize and thank, with the utmost of thanks, each and every person who works in our facilities, because an organization is only as good as those people who work within it. And without the people who day to day provide frontline care for our residents, we could not be here today. We could not look to the future. So we think it very important to thank our current staff, and we look forward to approximately 300 new people working within this facility. That'll be 300 unionized pension jobs, which will provide people the ability to raise their families in a dignified way in the great city of London, and we're really excited about that. Long-term care provides a cost-effective option within the care delivery chain, and we have the structures and procedures in place to promote best practices, and we're really excited about innovation. We want to look and work diligently with the LHIN to promote the best ways and the newest ways to ensure, again, resident care. We undertake to you, the community, that we will operate in a transparent and accountable fashion. We understand that we have to work hard to garner the respect and confidence of the community, and we make this promise to you that we shall fulfill. We are members of the Ontario Long-Term Care Association. We believe in the Ontario Long-Term Care Association. Candace Cartier is here, I believe. I haven't seen her. I don't see her back there. She was going to be here, joining us in the celebration. We applaud the partnerships between the Ontario Long-Term Care Association and the Ministry of Health and Long-Term Care. Those partnerships are really important because really, if you truly understand healthcare delivery, you understand that it's not done by one, it's done by partnerships. So we really appreciate and applaud the efforts of the OLTCA, and this facility, when it opens, will join the OLTCA. When organizing this event, we sent notices out to people generally in the LHIN and friends and colleagues. And the great thing about a groundbreaking like this, the greatest part is everybody's excited, everybody extended best wishes. So for those who could not attend but sent their greetings, we as well thank them very much for those good wishes. I'll conclude my remark by acknowledging that all efforts that we put forward to get this building in pre-construction, to build this building, to open this building, and ultimately to operate this building should be and only are directed to one thing: the resident. Resident care is number one. If you lose sight of that, you lose sight of the purpose. And Private Care is dedicated to people-focused quality care. So today, when we have Gwen with us, when we have Avinash, where's Avinash? Here he is, over here with us, both representing both the president and a representative of the resident councils for Burton Manor and Henley House, I make a promise to you as residents that this facility will be dedicated and focused at resident care. That concludes my remarks. May I please ask and call forward the Honourable Chris Brentley, Minister of Energy of the Province of Ontario.
Well, thank you so much, Matthew. I suspect I'm going to say a few things that are in everybody's mind. Matthew, you, Randy, the Melchior family, you took a lot of time through your speech to thank everybody else for what is about to happen here, for the journey that's already been taken, and for the journey you're about to take. But of course, as we all know, that journey doesn't even start, but for the determination, the vision, and as we've already heard, the risks undertaken by Primacare, your family, to make something like this happen. And I know it'll be echoed by many others, but I just want to thank you. I want to thank you. making sure that our seniors have the type of care that is appropriate for them, that they would like, is essential. It's what we all want to have happen. I'm delighted that I have a colleague, Deb Matthews, who's going to speak in just a second, who is working hard to make sure that all of the options are available. And long-term care is an essential one. You have spoken about how it's many people coming together. Private interests, public interests, all focused on one task, represented by the presidents of the Residents' Council, making sure that the people who call long-term care home have the best possible care, the type of care that in our mind's eye all of us would want in the future. My colleague Deb Matthews has an enormous task in making sure that since none of us is getting younger, that there is enough care and it's of the best possible quality for the time in our lives when that arrives. It is with a great deal of delight that I introduce my fellow London MPP, Minister of Health and Long-Term Care, Deb Matthews.
Well, thank you so much, Chris. I am just bubbling over with joy today. I have to say this is a moment that we've been waiting for, and we are so glad that today has arrived. I want to echo what Chris has said. Matthew, I found your words very, very touching. You talked a lot about what this meant, what this will mean for residents, and how you want to build the best possible environment for the residents. You talked about the people who are going to work here and how you want this to be a great place to work. So I thank you for that. Your focus clearly is on the right things. I also want to share something that I thought Michael might have mentioned in his words, but to me speak volumes about the character of the person who we're entrusting with this important project. He's wearing his dad's boots. His dad was in the construction business. My dad was in the construction business too. And his dad is watching from above, as he said, but his boots are on the ground. And I just think that speaks volumes about how much you care about what you do. So this is great news, and I'm very pleased that we're getting started on this important project. 192 more people will have the opportunity to live healthy, full lives in this new home. You know, there's I'm a demographer. That's my training. So when you make a demographer the health minister, you can imagine the things that consume my attention. We are, as Chris has said, with the exception of the people in this room, all getting 1 year older every year. What that means is as the baby boom grows, as the baby boom ages, and as our fantastic healthcare system keeps us living longer with more complex chronic conditions, that's going to change. The way we care for our elders is changing and must change. We know we've got a great opportunity to do better by our seniors. That's why I appointed Dr. Samir Sinha to be our expert lead on our seniors care strategy. And I know from our earlier conversations that the Melchior family understands that long-term care is just one part of care in the long term. And they've actually are starting already to think about how this place might be more than just a home for 192 people, residents, but also might have an opportunity to do other care for people who are choosing other options. You see, we know that we've got too many people in hospital who shouldn't be in hospital. It's not where they want to be, it's not where they're getting the best possible care, and it's way more expensive than other options. So we've got too many people in hospital who don't need to be there. We've got to find other opportunities for them so they get all the care they need, but all the independence that they so desperately want. We also know that we've got too many people going into long-term care who might not need the very intensive supports available to people in long-term care. They could do very well at home with the right supports, or in supportive housing, or in a range of other options. So we need this place. We need this place desperately. But long-term care alone is not the only solution to our aging population. And I'm delighted at the approach that the wonderful people at Primacare are bringing to this shared challenge. So we wish you all the very, very best. I was very pleased when George Smitherman back in 2007 announced that London would be getting 3 new long-term care homes. 380, 2 of those homes are already built and operating with 384 residents living there. Now we're looking forward to another 192. We've also redeveloped a lot of the older homes that simply didn't meet today's standards for long-term care. So we're moving forward. This is a great step forward. We welcome you to London. We welcome you to our community. And thank you so much for all you do.
Thank you so much, Minister Matthews. One point of clarification, Joel Knowlton, our Managing Director, who is so diligently involved with this event and every event involved with Primacare, is a London resident and a long-time London resident, so she is very much committed to the community. So, and we, as a team, of course, as well, are very much committed to London. His Worship, the Honourable Joe Fontana, was a Federal Minister of Housing and a Federal Minister of Labour. So it's probably very much old hat for him to come to see a groundbreaking for accommodation and care provision. May I call forward the Honourable Joe Fontana.
Well, first and foremost, good morning, and to Matthew and to Randy and to the Malcolm family, welcome to London. And thank you for the confidence that you have in this great city. There is no doubt that Brampton and St. Catharines are okay, but now you have chosen the best city in the country. And I think both ministers talked to you a little bit about what you do and how well you do it. But I want to tell you a little bit about this city, and thank you for making our vision and our dream come true, because I know that Minister Matthew and Minister Bentley, there's no doubt that this city wants to be known and is as an age-friendly city. That means from the time that you were born in London, Ontario, to the time that you can retire and even beyond, we are going to give you the greatest quality of life possible. Because I know that you will, with your residents, provide them the incredible care that you've demonstrated in your other places. But also as a community, as a municipality, we need to make sure that we can provide you and your residents with the most incredible experience as a community. And I know that London does that, and we are so proud of what we've been able to accomplish through our healthcare system and through our long-term care facilities and through the incredible people that reside in this city that are dedicated and so determined to make sure that the best quality of life is given to everyone. And Primacare is a perfect example of an incredible organization that has demonstrated that they get it right. I know that when I was the Minister of Housing, and I think Deb and Chris have spoken to it, you know, you're building bricks and mortars, and thank you very much for the 300 jobs. More importantly, thank you for the taxes. And they're the most competitive taxes, I want to tell you, in the province, but you know, I have a vision of making sure that this city grows. But what I want to say is that in building a community, there is no doubt, as the ministers have said, that you need to make sure that you have the right ingredients to make this the most incredible community going. And we are so fortunate in this city to have the most incredible healthcare facilities, thanks to the government of Ontario that has put in, $1.5 billion of commitment, of investment in our city. And more to come. And we need to do more for our community, and I know that we are determined together to do that with Jeff's assistance and guidance and good advice, of course. So I want to take this opportunity on behalf of the citizens of London, our City Council, to welcome you to our great city. I know that you are going to provide us with an incredible contribution, the contribution of giving our seniors what they want and what they deserve is respect, is dignity, is care. And yes, it's bricks and mortars are important, but you are building lives. You will continue to build and provide, as has been said, the quality of life that we want for all of our seniors. And there's no doubt that Primacare will do that for our citizens. And there's no doubt that I know that once you get to feel this community, as we all do, and I've got 2 or 3 other locations that I think that Primacare can do really well. And I want to thank each and every one of you for coming to our city, for joining in this great celebration. Spend an awful lot of money. Why? Again, I need taxes, so please enjoy our great hospitality. And again, welcome to our city. Congratulations on an incredible project that's going to provide hope, opportunity, good health care, and a lot of good paying jobs. And I appreciate that very, very much, and so does the City of London. Thank you.
Thank you, Your Worship, for those very kind words. And we promise to pay our taxes on time. The Southwest Lynn is an integral part, or obviously a fundamental part, in the care delivery chain for the Greater London area. The Lynn extends extensively wide and north up the peninsula and down towards Windsor. It's a very, very large Lynn, and this is a very busy time for the Southwest Lynn. They have to, in the next 30 days, put their strategic plan into the Ministry of Health and Long-Term Care. They've set out their priorities, which are obviously noble, and we very much work along with and believe in every priority you've put forward. We've been very fortunate to have CEO Michael Barrett and Board Chair Jeff Lowe come to join us here today. And maybe I could ask Chair Jeff to come up, please.
I was doing pretty good until that point. I was number 1 at that point.
It was doing a great job. This really is a day for celebration. I mean, what can you say? And I want to thank Primacare so very much for extending the invitation to the Lynn today to attend the celebration. One of the great privileges I have as board chair of the Southwest Local Health Integration Network is the opportunity to see healthcare in action and how it works across the Southwest, and how, frankly, how it works all across Ontario. And the good news is we seem to have a government that gets it. And we have ministers that get it. We have a ministry that gets it. We have a Minister of Health and Long-Term Care that really gets it. We have a mayor that gets it. And we have developers such as the Melchior family that absolutely put their minds and souls into this type of work. It provides great comfort to me personally, as I am aging rapidly, as you can see. But not only that, but it provides real impetus to what the Southwest Lynn does, and that is the integration of services for all people that live in the Southwest and in our neighboring lands and across the province. Deb mentioned before she's bubbly. I don't bubble. But I am really delighted that you folks have decided to build this opportunity here in the north part of London. It's not very far from where I live, by the way, which is, I'll have to bear that in mind. Because it ties in so very closely with what's happening in London, as Mayor Fontana has spoken to, and it ties in very closely to what's happening to healthcare, as I see it from a 50,000 foot level, by the way, as chair of the Southwest Lynn across the Lynn. So on behalf of our board of directors and the staff at the Southwest Lynn and our volunteers, I want to thank you and your family and the minister and the ministry, Mr. Bentley and Mayor Fontana and other dignitaries and all of you for taking the time today. And this is another piece in the puzzle of healthcare across Ontario. Thanks very much.
I appreciate all the thanks that have been directed towards the Melchior family, but I think they have to be directed towards Jill Knowlton, Adam Banks, John Bergen, and the entire team at Primacare, because it's the hard effort of all of those people that will make this a reality. I think it has to be thanks to the construction workers out there who work hard, and I want them, please, work safely out there to make sure that this project comes in quickly and on time. Go faster, please, go faster. And Jeff, thank you for not wearing bubbles. It was a good choice in the tie. The bubbles wouldn't have worked. Ladies and gentlemen, this concludes the remarks from the podium. If I could ask that we make our way gently over to the ceremonial sod pile, or dirt pile, for the shovel turning ceremony, that would be most appreciated. And again, I thank you very, very, very much for coming and celebrating with us this great and joyous event. Thank you.
Okay, everybody say heave-ho. Ready? Heave-ho. Here we go. Ready one more time? One, two, three. There we go. There you go. Well done, guys.